That patent that you obtained, what was that all about?
It's for tobacco smoking. It's for smoke. It won't see. There hasn't been anything new in smoking in over 20 years or more, and I discovered through learning about drug-induced nutrient depletions what's depleted from cigarette smoking and secondhand smoke exposure. And then I discovered what happens when you replenish those depleted substances in many of them, and it's shown in multiple studies now that replenishment decreases morbidity and mortality in statistically significant ways. So people have a fighting chance of having a longer and a healthier life. They will also decrease the number of cigarettes smoked, but it's not about getting them to stop, although it will decrease it, and it will change the taste of tobacco smoke in about 2 weeks.
Great. Is it a commercial product? I mean, is it?
I'm looking to sell the patent or get someone to manufacture and market it. A third of the world still smokes. Half the doctors in India still smoke, I'm told. And there's 300 million smokers in China and 700 million secondhand smokers. So the first talk that I gave, I don't know if I gave it through your group, but I presented my presentation on what I did for discovered with cigarette smoking, and then I shared all the labs, the studies on each nutrient that showed that replenishment makes a difference in terms of morbidity and mortality in statistically significant ways.
Okay. There actually might be a couple of our members here that may be able to help you with that.
I've been trying for 7, 8 years now. I would love help because I'm not well connected. Right. And I'm happy to give a fee for anyone that can help me get this onto the market. Okay, so because this can go worldwide. Listen, I don't get that many original thoughts, but this is one of them.
Well, Dr. Tano may be able to help you. He's on tonight, or Dr. Quinn. They're pretty they're entrepreneurial minded.
Who did you say?
Dr. Tano, Benoit Tano is on here. And
okay.
Quinn. Those two come to mind. May be able to lend you a hand. I can't promise.
Well, we should. I know. I listen. That's fine. But I think that there's been nothing for over 20 years, and people, if you speak to smokers, they're really open to something new. And the number of smoking cessation clinics in China has decreased markedly because there's nothing new. Johnson & Johnson, they're one of the manufacturers of nicotine gums and patches, has made, in 2022, they made $5.5 billion on a product, these nicotine patches and gums, that works only 25% of the time. And every year they're increasing their earnings 15% a year. How do you like that? A product that works 25% of the time and has increased earnings of 15% a year.
You don't want
it's unbelievable.
Good marketing.
Well, because then you'll put them out of their $5 billion business.
Well, you see, no, I won't. Actually, it dovetails with those products. Those products are putting a Band-Aid over a bullet hole, and I'm addressing the unwitting losses of antioxidants and micronutrients that are unwittingly depleted from smoking and secondhand smoke, and also for pregnant smokers. And also for those making a just quit attempt, it will help them stay stopped longer.
Have you heard of Alan Carr by any chance?
I have not.
Alan Carr, he's the author of the globally best-selling The Easy Way to Stop Smoking. Over 18 to 20 million books sold worldwide. And he's
maybe I ought to write a book.
He's got clinics throughout America and internationally. And you never know, might be interested in your product.
Is he an MD?
I don't think so.
Okay, well, maybe I'll find C-A-R or C-A-R-R?
C-A-R-R.
And
correct.
It's A-L-L-A-N or E-N?
A-L-L-E-N.
Okay.
The The Easy Way to Stop Smoking. Over
Okay,
18.
well, I would love to thank you so much.
Yeah,
I
you bet.
appreciate it, Joel. You're wonderful. Thank you so much.
My pleasure.
Dr. Harlan,
Yes.
Dr. Tano can help you write a book. He's got an AI publishing application. And, when people got to know, they got to learn that your product and knowledge is out there, that it can help them. And once more people know about it, that's going to help make it a reality.
Right.
I really feel that this can go because people want something new, and too many people have died from smoking. Now, it's not a perfect solution. It won't get you to stop, but it will decrease the number of cigarettes smoked. Actually, my secretary started this. I didn't realize when I hired her, but she was a 3-pack-a-day smoker. She's down to 2.5 packs. In a week, she was down to a half a pack, and she has less anxiety and she sleeps better. And she told me it took 2 weeks for the change of taste to occur. So it's not an antabuse-like reaction where you're going to vomit when you have an alcoholic beverage, but it doesn't taste as good, the cigarette smoke. And I have different formulations for secondhand smokers, people that smoke a half pack or less, people that smoke a half a pack to 1 pack or more. And then for pregnant smokers, there's less morbidity and mortality. There's less placental abruption. And then when the babies are born, their pulmonary function studies at 1 year are much better, and there's less cost to society. So it's a big deal, in my opinion.
Dr. Bieley, the state of Florida has a TV stop smoking cessation program. And if you could team up with the state of Florida,
I can't reach anybody. I haven't been able to get anyone to call me back.
Well, you gotta know who to call and get hold of them. That's the hard part.
All right. If I could interrupt for 30 seconds because I'm too lazy to type.
Yes.
We have a research committee already established within this group. So the people that you were supposed to contact via Bill Clearfield, Dr. Tano, and Dr. Quinn are
Yes.
already involved with this in a big way. It's unbelievable how much they've produced and done. So anyway, our committee that could help you with research in this process, because we're trying to also do some serious, honest to God research. So it's kind of a complicated thing, but it'll give our group credibility. But at the same time, every Saturday at noon Eastern time for the next 6 weeks, every Saturday at noon, the research committee for AOSRD is going to be meeting. And you are welcome to join us and be equal in everything we're doing, because all we're trying to do is help people. So we'll make sure you get that invitation to our Zoom on Saturday and join the crew.
You're very kind. Thank you, Dr. Burgess.
Also the Indian tribal world.
Yes. This involves the Indian tribe separate from the United States government. We're also doing things internationally so we don't get hung up in stupid stuff.
Yes.
So this is quite a committee. This is quite a thing we're doing because we're by-stepping the United States. We want the truth. We don't want hassle. So the tribe can do it without hassle. Our international efforts can be without hassle. And people like you are the ones we want. Thank you.
Thank you so much. That's very kind of you. You're very generous.
All right, Dr. Bieley. So we're ready to rock and roll.
Okay. Do you need to cover your club information first?
Oh, we're good. We're good. We'll get it.
Okay.
More along.
Okay.
So,
So everyone, tonight, you all do different aspects of medicine, I guess, different fields. So I'm going to cover some medicines that may be in your field that you prescribe a lot. So I'm going to go slowly so you can write down what nutrients are depleted if you didn't know. There's a couple of books that I'm citing. This one is from Dr. James Laval. It's on drug-induced nutrient depletion. It's over 20 years old. He doesn't make any more. This is the second edition, and they stopped printing it. The other book is from Pam Smith, She was head of my fellowship in anti-aging medicine. And so those are the two sources of the materials that I have. So our purpose is for you to know that for over 20 years, roughly half of the medicines used in society cause some drug-induced nutrient depletion. And I'm going to show you what they are tonight. And that number hasn't really changed. As doctors, we typically consider the history of the present illness along with allergies and medicines, because we don't want to give a drug to a patient who's obviously allergic to it. And also we want to consider drug-drug interactions and side effects. The use of drugs has risen in our country and around the world. In the United States, the use of 2 or more drugs has risen 20% in the last 10 years, and 5 or more drugs has risen 70%. In 2020, the drugs prescribed in China has risen in 10 years from 60,000 to 260,000 in 2020. Polypharmacy has risen from the success of the pharmaceutical research and from development, and of the willingness of consumers, governments, and society to pay for them. Now, in Sweden, and this slide is from, I think, 2020, if you were taking 5 to 7 medicines, you were 4 times more likely to experience a drug-drug interaction. If you're taking between 8 to 10 medicines, you were 8 times more likely. And if you're on 14 or more medicines, you were 20 times more likely to have a drug-drug interaction. And this is now an unmet and underappreciated need that the medical community needs to consider, is drug-induced nutrient depletions. As I said, about half the drugs used in clinical practice have documented nutrient depleting effects. Here are some of them listed. This is from Dr. Laval's handbook that I use on every patient when they come in to see me on the first meeting. Because if I identify a nutrient that's depleted from a medicine that they're taking, I have a code that I can use to pay for a lab test that looks at nutrition assessments and, nutrient levels. And again, here's the references from Dr. Laval and Dr. Pam Smith for this material tonight. So let's get started. First one is birth control pills. And what they do, it just as a reminder, they increase sex hormone binding globulin, so that lowers testosterone levels, and it also lowers progesterone levels. The progestins are not the same as progesterone. And progesterone and progestins have kind of opposite effects. Progesterone causes coronary artery vasodilation. Progestins cause coronary artery vasoconstriction. And the comparisons go back and forth on and on of these opposite effects. So these are what is depleted are fatty acids, vitamin B1, B2, B3, B6, B12, magnesium, selenium, zinc, tyrosine, coenzyme Q10, and vitamin E. Anti-ulcer medicines depletes vitamins B12 and fatty acids, vitamin D, calcium, iron, zinc, and protein. And antibiotics in general deplete the B vitamins and vitamin K. Anticonvulsants deplete fatty acids, vitamins D, K, and calcium. Diabetes medicines deplete CoQ10, fatty acids, and B12. Metformin depletes B12 and folate. I never use folic acid. I guess I'll just get on my bandwagon and talk about it. Folic acid lowers natural killer cells. It's synthetic folate. Natural folates are uncooked green leafy vegetables. And folic acid never makes it down 12 steps to the MTHFR gene. but it's been also shown to increase colon cancer by 40% in Mexicans. So I would never use folic acid. I'd always use L-methylfolate or quadrifolate or even folinic acid. But there you need B6, B12 to make the pathway work, the methylation pathway. And one other nutrient, which I'm forgetting at the moment, sorry. But TDZs cause bone loss. Sulfonylureas deplete CoQ10. Biguanides deplete CoQ10, B12, and fatty acids. Antihypertensives, especially ACE inhibitors, deplete zinc. But in general, they deplete B6, CoQ10, calcium, magnesium, vitamin K, and zinc. Hydralazine depletes vitamin B6 and CoQ10. ACE inhibitors, as I mentioned, deplete zinc. Aspirin and NSAIDs, acetaminophen, anti-inflammatories, they have their list. Aspirin depletes vitamin C, fatty acids, vitamin B5, calcium, iron, sodium, and potassium. And the famous one, Tylenol, or shouldn't say that, acetaminophen, depletes glutathione. So the Tylenol overdoses cause liver failure because of the depletion of glutathione. NSAIDs depletes folate and melatonin. Anti-inflammatory medicines deplete calcium, vitamin K, zinc, iron, vitamin B6, vitamin C, vitamin D, and fatty acids. Anti-cholesterol medicines like statins deplete CoQ10. Fibrates deplete B12, vitamin E, zinc, and copper. Gemfibrozol depletes CoQ10 and vitamin E. Again, statins block HMG-CoA reductase. Therefore, you can't make cholesterol or coenzyme Q10. And that's why you need CoQ10 when you take statins. Biosequestrants like cholestyramine depletes all the fat-soluble vitamins, but also vitamin B12 and also calcium, magnesium, phosphorus, zinc, iron, folate, beta-carotene, and fatty acids. Beta blockers deplete CoQ10 and melatonin. Phenothiazines deplete riboflavin, CoQ10, and melatonin. Tricyclic antidepressants deplete riboflavin and coenzyme Q10. So if people are taking these things for long periods of time, there's a greater chance of a drug-induced nutrient depletion and of a side effect from that. And so it should make you think now we should order a nutrition assessment to see if the B vitamins or minerals are depleted. MAO inhibitors deplete vitamin B6. Haloperidol depletes CoQ10, vitamin E, melatonin. Lithium depletes inositol. These benzodiazepines deplete melatonin. The loop diuretics have their own depletions: calcium, magnesium, vitamin K, vitamin B1, B6, and vitamin C. Thiazide diuretics deplete magnesium, vitamin K, zinc, and coenzyme Q10. The potassium-sparing diuretics deplete calcium, zinc, and fatty acids. Digoxin depletes calcium, magnesium, and phosphate. Here's some anticonvulsants. The divalprox depletes fatty acids, carnitine, copper, selenium, and zinc. The barbiturates deplete vitamins D, K, fatty acids, biotin, and calcium. Phenytoin depletes vitamins D, K, B1, B12, fatty acids, biotin, and calcium. Carbamazepine depletes vitamin D, fatty acids, and biotin. Mycilin depletes vitamin D, fatty acids, biotin, and calcium. Corticosteroids deplete vitamins A, C, D, K, B6, B12, fatty acids, calcium, chromium, magnesium, selenium, and zinc. That's a lot. Colchicine depletes vitamin B12, calcium, sodium, vitamin K, and beta carotene. Sulfasalazine depletes folate. Indomethacin also depletes folate and iron. And laxatives deplete fat-soluble vitamins D, E, A, and K. Antacids deplete calcium, phosphate, and folate. Now, nicotine is a stimulant. It's a medicine. And I lectured on this before. I'm not sure if this was the group that I gave the lecture to. I have to speak to Shell about that. Tobacco is a drug. It's highly regulated, highly addictive. It's regulated throughout the world. Now, this is something new. This is what I disclosed about a month or so ago. These are the nutrients that are depleted from tobacco smoke and secondhand smoking. And none of you need to believe a damn thing I say tonight because it's all backed up with references. And I have 115 references here. I'd be pleased to share the references with the abstracts, along with a letter from another doctor who wrote a textbook on laboratory medicine, Dr. Richard Lord, who affirmed my idea of of replenishing the depleted substances. That is a good idea. So these are the ones, and you're not going to find it in any textbook. So if you have smokers, the key nutrients here, vitamin C is key. Vitamin B6 is key. The higher the B6 level, the less amount of lung cancer you're going to get. That's been shown in multiple studies. One study had over 500,000 participants in multiple countries. Depleted B6 and methionine, actually. Well, their B6 and methionine were depleted. The lower the levels, the more lung cancer. And then the main thing is to prevent the depletion of these nutrients. You won't get the cancer so much. Minerals, magnesium is really important, as is selenium and zinc. But magnesium, the highest magnesium, the higher the magnesium levels, the less the stroke risk in Swedish population of over 20,000 people were in this study. So magnesium is really helpful to prevent stroke. And glutathione and NAC are extremely important as well to prevent disease. So about half the drugs used for the last 20 years have a drug-induced nutrient depleting effect. Tobacco smoking and secondhand smoke exposure cause drug-induced nutrient depletion by unwittingly depleting antioxidants, micronutrients, and other substances. Replenishment of some of these depleted substances reduces morbidity and mortality and improves biomarkers. And that last step 3 there was part of my other lecture, because I had the whole lecture, a PowerPoint presentation was on those studies that showed, in multiple studies for each nutrient, reduction of morbidity and mortality. And I thank you for your kind attention. I'm sorry for the brevity of the talk, but I hope you found some of this of value. Any questions?
Dr. Bieley,
Yes, sir.
Back to one of the slides.
Okay.
Thank you.
I'm sorry, I can't hear you.
Go back to the
Go back to where?
That's fine. You have a list of list of nutrients. What do we do with this list?
Well, when you're prescribing the medicines, you want to supplement if it's going to be on a long-term basis, and you check their levels, and then supplement. Otherwise, people will develop these deficiencies, and they may have problems. Like with the statins, you need CoQ10, or you're going to run into trouble.
Right. And so,
Excuse me?
how much CoQ10?
You have to measure the levels. Now, there's a problem with CoQ10 in the capsules, and this is an experiment everyone can do. If you get a liquid CoQ10 capsule, you want to open it up, cut it open, and squeeze it onto your fingers. You're going to get orange fingers. And then I want you to rub your finger and thumb against it. If you feel a grittiness, those are crystals. That means the CoQ10 molecules are stuck to the crystals, and it does you absolutely no good. So you need a crystal-free CoQ10 product. Zymogen makes those. There are other companies that make it as well. They make 50 milligram capsules. The other capsules, I don't know if they're crystal-free, but you want crystal-free for the CoQ10. And then it depends on how low you are, and there's also a CoQ10 product from Australia or New Zealand. That's a powder. It's 1,000 times more powerful than what we have in this country. It's called MitoQ, MITO-Q. It's from Australia or New Zealand. It's a wonderful product.
Okay. So, do you do serum blood tests? Do you do urine tests? Do you do red blood cell tests?
Well, I like to do Genova Diagnostics functional medicine testing. So, for example, if your B12 level is good, or if it's in a good number, but if methylmalonic acid is elevated, you don't have enough B12 to meet your functional needs in your body.
Okay.
So I like functional testing. Otherwise, red blood cell membrane, red blood cell, magnesium and zinc and copper. I do those. But there's other cells that also you can look for vitamins in them as well. And I don't remember which ones, but that's from Dr. Jonathan Wright.
Okay. Okay. There's a question of what nutrient test is the best. You said the Genova one?
Yes. It's called the metabolomics test from Genova Diagnostics.
Okay.
There are other tests that look at intracellular levels, but I forget his name, I'm sorry. But he did a split level. He took the same blood from one person, and he put two different names on it, on each tube, and they got different levels back with the intracellular blood testing. So he doesn't do that anymore.
Oh, well, we've done
Mitchell Genn, Dr. Genn, shared that in his talk one year.
Well, we've had that from LabCorp. We had I sent somebody in with a lab, and they went from their regular doctor, and they overlapped. They did the same CBC, and they got the two or thyroid tests. They got two very different answers. It's not uncommon.
When I do my thyroid testing, I have patients take their thyroid medicine 4 to 6 hours before their blood is drawn. The reason is the half-life of T4 is about 4 to 7 days, but the half-life of T3 is about 4 to 6 hours. So I want to see that their free T3 is in an optimal range, that they're, and so that's why, because if it's not, we can always bump up their thyroid medicine and adjust it. So that's why I do that.
Okay.
Oh, another thing in my thyroid testing, I also check for vitamin D. You can have all the steps that make thyroid hormone, but once it gets into the cell, it needs vitamin D to transport it from the cell to the nucleus. So that's part of my vitamin D evaluation.
Okay, so let's say I'm coming to see you, and I'm taking atorvastatin. I'm taking atenolol. I'm taking furosemide, and I'm taking metformin. So that's diabetes, high blood pressure,
Yes.
and cholesterol. So your typical American diet guy.
Yes.
So what's your approach?
Well, what are they coming in for?
Well, I hate my doctor. All they do is they give me drugs. So I need to be I need a more holistic.
Well, one thing I would also do besides do the nutritional testing that I mentioned is to check them for nitric oxide. So I have test strips that I give all my patients. They put it on their tongue for 10 seconds. And if they're lower depleted, I give them a capsule from Berkeley Life because nitric oxide plays a role in all the hormones. It's kind of and the guy won a Nobel Prize for it too. But it plays a role in sexuality and how it actually can lower your systolic blood pressure. It lowered mine 15 points right off the bat when I discovered I was depleted. Now, at age 60, you only make 15% of what you made in your youth of nitric oxide. So I would check them for nitric oxide, and I would do a nutrition assessment to see what's going on. And maybe when they fill out my forms, if they're depleted in testosterone or if they have a lot of growth hormone deficiency symptoms, I would check them for those things as well.
Okay. Do you have like a routine, sort of, here I am?
No, I'm sorry. Every patient is different. Every patient is unique. Just like mold inspectors, when they go to a home, every home is different. And you need someone really good to find mold in their homes. Actually, half my practice now is mold. Believe it or not, in South Florida, we have a lot of water damaged buildings.
I was going to say,
and bad contractors.
Okay. All right.
But I first ask, what brings you here? And then I shut my mouth up and I listen.
Okay.
And then based on what they tell me, then I move towards that and I can address that by, particular testing or whatever. So that's my approach.
Okay.
So Dr. Harlan, you made a comment about MitoQ. So I actually had a conversation with the company and Dr. Houston. I don't know if you're familiar with him.
Yes. And Mark Houston also. He's
right.
One of the great lecturers.
Right. So this is something that he mentioned to me, that MitoQ, when you use it, especially the one that's specific for cardiac, you actually have to use a different CoQ10 for the reason that the cardiac MitoQ will definitely more concentrate on the cardiac muscle and not for the systemic circulation. So thus, doing two separate CoQ10s, which is of course ubiquinol, as we always kind of choose it, is always the right move when you do CoQ10s. So that's a kind of like a clinical pearl that he gave out for us.
So use ubiquinol and what else? And the MitoQ?
Along with the MitoQ.
Okay. Thank you. I didn't know that.
It's not going systemically. It's really more of a focused on cardiac.
I see. Oh, I didn't know that. Thank you so much.
Yes, and also a poor man's test, the one that I do. The one thing that we always use HSC or I'm sorry, homocysteine for our B12 folic acid, right? Methylated versions, but another one is a high folic acid on testing is also another clue for us to see if they're methylating properly. So accumulation of just plain folic acid can also be a predictor for you if somebody's methylating properly or not. And that's definitely a part of your replacement for the nutrient depletion.
In my other talk on tobacco smoking, one slide I didn't have is smokeless tobacco. Now that didn't deplete any nutrients, but homocysteine levels were raised tenfold. So there's got to be a B6, B12 folate or trimethylglycine deficiency in there somewhere.
So you mentioned about that. So now let's go into this discussion of what are your thoughts on vaping and then smoking marijuana? I mean, of course, that's cigarette smoking.
I'm mostly looking at tobacco smoking and secondhand smoke and pregnant smokers. But for vaping, I haven't found any nutrient depletions, although they can get popcorn lung, and the vitamin E is changed. I don't know how it's changed, but it's not good.
Right. Is it from more when you talk about tobacco smoking? Is it from the nicotine? And also, if you do a nicotine patch, I don't know if you mentioned that already, that it will also deplete the same nutrients?
I don't know that that's been studied, the nicotine patches, if they deplete nutrients or not.
It's more specifically for cigarette smoking then.
Oh, hold on. You know, it's through these dialogues that we learn.
Sure.
And so I haven't checked the nicotine patches, but I think it's from the thousands of chemicals that are, you know, it's been one big oxidative stress. That's tobacco smoke. And through the loss of, you know, with all those thousands of chemicals, some of which are, you know, very toxic and carcinogenic, you know, whatever, 20, 30, 60, whatever the number is, these nutrients get depleted. And that replenishment of these depleted nutrients makes a difference. It decreases morbidity and mortality in statistically significant ways. And that's not just from one study for one nutrient, it's multiple studies on the same nutrient, like vitamin B6 as an example. Now, I can't claim causation. I'm not a you know, statistician, but I can claim an association. But one of the studies was with over 500,000 people, so there's got to be. But I'm not able, because I don't know enough to be able to claim causation. But I can show that it's associated.
Well, the topic you just discussed, drug-induced nutrient depletion, is starting to be, because I attended a conventional conference this past weekend. And one of the things that they mentioned there was actually PPIs. So PPIs is really amazing for them to recognize that some of the clinician lecturers there are actually saying that this is only supposed to be taken
90 days.
Time. That's right. And now they're starting to unveil that. And it's nice that hearing from that type of conference, these types of comments, is basically them being aware of such. So that's actually a good.
Yeah, it's actually they're 20 years behind the times, basically.
Right.
It's about normal.
It's about time. It's about time.
So, so there's a couple of questions in the chat. How do you feel about hair analysis? Is that accurate?
For detecting heavy metals, it can be. I like doctor's data. You can do the hair analysis, but you can do the urine provocation testing with DMSA challenge of 20 to 30 milligrams per kilogram of DMSA. I understand it is accurate.
Okay.
But that's for heavy metals. I don't know about the nutrients.
Okay.
I just don't know.
There's also a
It,
comment.
it gives you a historical timeline. It doesn't say what's happening right now.
Right. The BL capsules contain K nitrites. Isn't that saltpeter?
I don't know what that is.
Yeah. I don't know. Anybody can help me out? Dr. Hopper, can you help us out here? You're the one who asked the question. So, okay. No answer. Okay. Is nitric oxide something that can be taken regularly, especially over age 60, assuming that they only produce 15% of it?
Yes. There's high nitrate foods like soft lettuce. Swiss chard has high nitrate concentrations. Bacon has a lot of nitrates, but it's also saturated fat, which I'm not sure is such a good idea. But the Berkeley Life products, I find they work longer in me. Now I have an MTHFR C677T polymorphism. I'm plus. And even those, I still need to take it all the time. Not in addition, the use of methylene blue tends to extend the life of the nitric oxide. So I feel that it prolongs the effect of the nitric oxide capsules.
Since you mentioned that, another product that's out there in the market is they're using hydrogen sulfate to actually increase nitric oxide as well. So they're finding different pathways now to not only through direct nitrate inclusions and supplements. And I think part of some of the webinars, they also introduced arugula because they were also concerned about the formation of oxalates when you're using these beet products that are out there in the market. So as you can see, this nitric oxide world is starting to evolve, and as we move forward, it's really something that has promise in the future. And as mentioned by the question, actually, it's not only above 60 years old. I mean, I use it myself. I use it on younger people who are just has specific comorbidities, like high blood sugar itself is very oxidative, and it lowers your nitric oxide production. So overall, it's just healthy and safe.
Yeah, and I check everybody that comes through my office right off the bat with the test strips. You know, when you can show someone color change or a lack of a color change, that has a big impact. You know, and then I give them a handout on nitric oxide. Most of the information is from Beth Shirley, who has she's a nurse or a nurse practitioner. She's done a lot of research on nitric oxide. Nathan Bryant has also lectured quite all over the world on nitric oxide as well. But I give them a big 4 or 5 page, 6 page document. Maybe it's 9 pages now. But when they leave, they understand about nitric oxide because they've seen with the test strips, it's easy to do.
Yeah, and we had them both in the webinars here, and they also have topical nitric oxide as well.
Oh,
and that's they mix C and also the nitric oxide solution together, and they use it on I guess more for anti-aging for wrinkles, as according to their presentation. But yeah, topical form of nitric oxide is out there also. A little expensive, but definitely worth your money if you're going to be using it.
Dr. Terry Hertog combines multiple hormones in a syringe and injects them for wrinkles. You know, hormones work usually at a distance, but they can also work locally as well. And I've never seen anyone in this country use multiple hormones in one syringe for wrinkles. And he thinks out of the box. He's wonderful. And he's
Dr. Phil, can we do that here in the US? I think he's
Brussels.
a European-based practitioner.
Oh,
Yeah, he's in Brussels.
yeah, he's got some wild ideas. Let's just leave it.
Okay. Well,
Yeah, no, you know,
it's good. It's good. I think it's good to get different points of view from people around the world. And
he's one of the
he's
super.
he's fourth generation endocrinologist, hormone specialist.
Yeah. He's one of the superstars, no doubt about it. But sometimes I think he carries it a little bit too far, but that's my own opinion. So, so somebody asked, I'm not sure what this means exactly. What is your opinion on keto analog use for renal cases?
I don't know enough about it to comment. I'm sorry.
Okay. And there's a couple questions about where you get the test strips. It usually comes with the nitric oxide, right? That's
Berkeley Life sells test strips separately.
right. And it says, which test strips do you use to check for nitric oxide? Every time I get nitric oxide, the test strips come with it, so I don't even ask for it. So
I use Berkeley Life. That's who I use.
yeah, and yeah, and where do you get the nitric oxide? You can get it on full scripts. You can get it from Berkeley Life, and
Doctor Supplement Store also carries them.
yeah, probably. Trying to think. Emerson Ecologics, I think they have it also. So it's pretty readily out there. So, so Dr. Mustafa, you asked again about keto analog use for renal cases. I'm not exactly sure what that. So if you're on, could you clarify? Okay, and then Dr. Hopper has the chemical name for saltpeter is potassium nitrate. So that says that's what Berkeley Life uses in their products. So
If I could interject 1 second, because we mentioned two things that we're dealing with. One's nitric oxide, and through Elizabeth, by the way, who's been wonderful. And but also we're seeing changes in cholesterol that could be completely amazing, altering, and change the pattern of medicine in America. We're seeing cholesterol go down now. We've seen like 5 patients where that's happened, where they have been resistant to reduction by any means, any medicine, and they're taking the approved solutions, nitric oxide, and dang it, the cholesterol just drops. So we're talking about nitric oxide strips, but part of our research program should include, and we've already contacted that company, it should include nitric oxide's ability to reduce cholesterol. It's a big issue. And I think Elizabeth, was she the one who they checked and there was no cholesterol plaque? Like none?
is that
So this is
who you're talking
it's revolutionary. And we're going to include that in the research. I thought I'd just mention that because it's a big deal.
Is that Dr. Shirley that you're talking about? Elizabeth Shirley?
Oh, yes.
Shirley? Yeah.
Yes. And she did the cholesterol plaque test with the new machine, and there was nothing there. And that's
wow.
like shocking, absolutely shocking. And she had a brother who had a heart bypass, another brother who had the stents. They checked her, and there was nothing there.
Wow.
And then the patients I've been trying, they're definitely seeing the benefit. But the cholesterol is what I'm all about. If they can get cholesterol down with nitric oxide, that's extraordinary. And I believe most of the nitric oxide products don't have nitric oxide in them. They're all supplemental action, even herbs.
Yes.
Well, that's wild stuff. So you have, 10, 20, 100 different nitric oxide products. None of them have nitric oxide. So whatever the combination is that Elizabeth.
Well, Beth says nitrates make nitrites make nitric oxide. That's how that Berkeley Life product works. I use for lowering cholesterol high fiber fiber. That And also I use tocotrienols to block the oxidative stress, the oxidation of LDL. So I use fiber and 20 to 30 grams of fiber a day. There's a product I'm blocking on its name now, but you put it in water and it doesn't look like anything's there. And so you can use 20 to 30 grams without bulking up. And then tocotrienols. The gamma delta tocotrienols prevent the oxidation of LDL. And so I use that along with fish oil to lower triglycerides. Those are my three things that I like for cholesterol issues.
Have you heard of cyclodextrin, Dr.
I
Harlan?
have. I don't know much about it though.
Yeah, so that's something that's on the rise here, being used as a new delivery method of medicines to be absorbed better. And at the same time, it acts like an HDL in your system that's scavenging your bad cholesterol and taking it to the liver. So it's all like hitting two birds with one stone. It's been, yeah, it's been spoken about recently in webinars here or other webinars.
Yeah, the problem is it's very expensive.
Right.
$50 a month.
One of the reason I mentioned the nitric oxide, if you deal with the approved solutions and Elizabeth Shirley and her helpers, Claudia, I think, or is it Donna? I forget. But anyway, if you buy more in bulk, which I did, so if you buy 43 bottles at a time, they give you pretty much maximum discount with that. And if we're going to do research with them, I'm going to see if they can give us even more discounts. So if anybody within our group wants to do research on this with their approval, they can probably reduce the price even more. So I'm talking about $25 for a month's supply.
Wow.
That's pretty reasonable. And
Yes.
that's still doing the 2 capsules a day, 60 capsules, $25. So they're trying to work with us, but if we all work together with the research on this cholesterol, I think it could be mind blowing and we could get it for cheap. And we're already getting it for cheaper.
So John, you mentioned about this nitric oxide. Since we're on the nitric oxide bandwagon, one of the things that I actually use it on with my patients would be ED. So taking these nitric oxide capsules 30 minutes or 20 minutes before, that actually had resulted in, I'm not saying it's going to solve your ED, but definitely enhances erections for men and also neuropathies. Currently, there's a company out there that's actually doing a study on how nitric oxide is affecting neuropathies in a specific institution that they're in. And they have been seeing good results with that. And neuropathy, you have to remember, is very hard to treat. We throw B6, B12, folic acid at it, and sometimes it just wouldn't work, and even all the therapies. But nitric oxide seems to be one of the one who's getting closer to that mark to prove that it can actually help with neuropathies.
Yeah, big deal, I think. But I think it's which nitric oxide are you using? I just stumbled into this. So to see the huge benefits we've seen, just because we trust Elizabeth Shirley, right?
Right. Well, there are two ones out there in the market. One is long acting and one is short acting. Because of the CME, I'll probably put it in the chat.
Okay.
The one that we're mentioning right now has been said to be shorter acting, which are the products that you're mentioning. And then the other one that actually uses hydrogen sulfide actually is the longer acting, because you can take it 2 caps in one day, and that will supply your 24-hour supply of nitric oxide. So that's why it comes in a little bit more of a price here tag when you buy that.
Okay, thank you.
Okay. Is it nitric oxide for neuropathy okay to use in dialysis patients?
Yes, so in those studies, they're actually talking about, so neuropathy, as we know, has a high correlation with diabetic neuropathy. And majority of these patients, I'm not saying majority of these subjects has already CKD4, but CKD3 has been noted in CKD2 on the studies. But overall, so far as I've seen the studies of nitric oxide, really dialysis patients wouldn't be a contraindication for it.
Mm-hmm. Okay. So any of the medications that you mentioned in your talk, Dr. Bieley, nitric oxide gets depleted?
I didn't see anything. No, sir.
Okay.
I don't know that that's been studied.
Okay. Okay, John, mark that down.
Got it.
Dr. Bill, in one of your lecture, I remember about methylene blue.
Right.
Yes,
Did you
sir.
mention that it can drain nitric oxide? I don't know if I remember that right. Maybe correct me if I'm
Well,
wrong.
my experience is that it enhances the effect of nitric oxide. And that's why it's sold. That was what was discussed. There's a vendor at A4M conference that had the methylene blue, that it enhanced the effects of nitric oxide. So you're going to get blue urine, but increased erections, I guess.
Right.
Yeah. There's always a give and take, right? So
Yeah.
So that's it. Okay. Any concern with pro-inflammatory effects of raising nitric oxide?
There are different types, enos, and I don't think there are. I don't believe that there is.
I mean, I've heard.
Well, the problem there is the uncoupling, the enos, because as we grow older, the enos is actually not as effective. That's why production of peroxynitrites are probably going to be the one involved more for the pro-inflammatory effects rather than actual nitric oxide. So it's really the ability of that enos in terms of coupling and uncoupling and how it will be converted into.
Okay. So does that answer the question, I guess? So, I mean, I've seen some reports where too much nitric oxide is detrimental sort of to long-term health. You know anything about that? Anybody? So
The one that I've seen, actually, some anecdotal patients would be hypotension. So when somebody's already on a blood pressure medicine, some of the patients would say that adding nitric oxide to their regimen actually lowers down a little bit more. But on studies, really nitric oxide is what we call a modulator. Even though your blood pressure is getting low, it will actually just make it more steady on where it is. That's why these are anecdotal. And even with patients with these sensitivities, I always tell them before you take your nitric oxide while on a blood pressure medicine, you definitely want to take it first. But it's not a contraindication for me to stop these supplements in relation to that.
okay. Any interactions with nitric oxide and cardiac meds?
I guess that's the one of the perfect example there. If somebody's already taking a antihypertensive agent, if their blood pressures go low already with that and you add nitric oxide to that, that's definitely not something that you want to stack up on. But again, very, very few patients react to this. But overall, as said, nitric oxide is not reactive to almost any other medication. It's very safe on the profile.
Okay, so it acts as a vasodilator, is that?
Yeah, it actually does. And there's the lowering capacity of a nitric oxide in terms of the points in systolic, diastolic would be around, the most would be 10 and then 5 on the diastolic. That's the most. But you have to remember that not with gut issues, for example, these are all capsules that we're taking. It's not going to be maximized in terms of the full capacity. That's why you see around what 8.5 in terms of lowering down the systolic, diastolic. So it's really not much to lower down the blood pressure, really.
Okay. How about any interactions between nitric oxide and estrogen, since estrogen is a vasodilator? Carol?
You probably know more than I do about that one.
Well, I believe that nitric oxide helps all the hormones. It has, if you will, I can check and tell you about that. Maybe I'll send it as an email to you,
Okay.
the handout, and it does discuss estrogen in there. I just don't remember what it does.
Okay. Carol, do you have anything on that? No? Okay. All right. Okay. So CME credits are back on. There's the link right there. I'll put them in the email address. We'll try and catch up on the ones that got missed. I don't know if we're going to be able to get them or not, but the CME provider is back online. So there's the 9378, and we had the one from last week also. I can look at the last week was back also. So we just hit that link, answer the few questions that they ask, $30, and you get a certificate for 2 AMA CME credits. So I'm trying to find out if we can get AOA credits also, but so far I haven't heard anything back. So Dr. Bieley, any summary here? We're going to wrap up early tonight.
Well, I would say the important thing is to have this in your consciousness. When you came into this lecture tonight, you were looking like your point of view is like a foot wide. I hope it's expanded, and that people will consider drug-induced nutrient depletion more when they're giving people, especially polypharmacy, and for people taking medicines for long periods of time, they need to take a look into the nutrient depletions to prevent that from happening to their patients.
Okay.
Dr. Harlan, just a follow-up question, one of the more famous drugs out there, GLP-1s. Have you have any literature about what specific nutrients they can deplete?
I don't know the answer to that. Semaglutide, I don't know.
Okay.
But we did go to a peptides conference from Dr. Bill Seeds a couple of weeks ago in Disney World. And the Four Seasons Hotel, this group are hotel snobs. That place has the wow experience when you walk into it. It was a magnificent facility. And we learned about new uses of peptides and other peptides as well. Just great lecturers. But I don't know the answer to that question. I'm sorry.
All right.
I guess it really comes more with of course, the gastroparesis. You're not going to eat much. So just by you not eating enough just brings a lot of deficiencies right there, especially the proteins. That's why muscle wasting is part of that. But I'm sure there's going to be some studies out there in the future that will show specific nutrient deficiencies about it.
Huh. Well, we want weight loss though.
Right.
As long as you're losing weight, it's all good, right?
And you don't aspirate on the gastroparesis. Yeah, then it's good, and you don't die from it. Okay, that's all I have. Thank you very much for the opportunity to share with you guys.
Thank you.
It's a real privilege and honor for me because I don't get up and speak much. I'm mostly one of the students taking notes
Okay, well, thank
in
you.
the crowd.
Thank you for being with us, and we're here every Tuesday night at 8 o'clock your time.
Okay.
You'd like we can, we put you in our email address so you get to know what's coming up. Which, by the way, next week we have Dr. Felice Gersh, our integrative OBGYN. And
Yeah, I've heard her lecture before. She's very good.
She's gonna talk to us about estrogens and breast cancer, and she's going to talk to us about cycling hormones, postmenopausal, and I'm going to even ask her about estrogens and estrogen blocking with testosterone. Maybe we'll get that out of her also. So, okay. So,
and thank you, Dr. Burgess, for the invite for this other group, I'd be very happy to participate and get some help
Thank
with
you.
this.
Okay.
Okay, thank you all.
Okay.
Thank-
So thank you, Dr. Bieley.
It's
And
pronounced Bieley, by the way.
thank you, Dr. Bieley. So
You're welcome. Thanks.
we'll see it. We'll try and catch up with you at an A4M. It sounds like that's where you're hanging out.
Yes, sir.
Okay,
Thanks.
Dr. Quinn, you got anything for us?
Oh, yeah, always, of course.
Mhm.
A couple of strange things here. Dr. Bieley did mention about the conversion of nitrate NO3 to nitric NO2 and then to I'm sorry, nitrate to nitrite to nitric. And I think according to Nathan Bryan, part of this is done in the mouth, right? And one of the
Yes.
things that's pretty real world important is that the use of mouthwash can destroy the microbes that will convert the NO3 to the NO2, I believe. So it's a good idea to make sure that your patients don't use a lot of mouthwash. Okay, that's pretty critical, really, according to him. The other crazy thing is that I truly believe in these supplements. We've been using these for years. Getting the nitric oxide from the precursors, arginine, citrulline, or whatever, from green leafy vegetables is wonderful unless you are eating organic vegetables, because they do spray the nitrates onto the non-organic green leafy vegetables, and there's a little source of nitrate right there. If you're organic, you can't use nitrates. So I heard of a study a while back that showed that there was less nitric oxide with organic green leafies than there are with the non-organic kind. Just a couple of crazy little things there.
Mhm. Okay. So, by the way, Dr. Quinn, I don't know if you got it. I rewrote that paper that Dr. Burgess sent me, and sort of hopefully cleaned it up a little bit. And I actually have a video just about done.
Oh, wow. Yeah, I did. I responded back.
Oh, you did? I didn't see that.
But Dr. Clearfield, Nathan Bryant has said that they're anaerobes in the crypts of the tongue. That's where the nitric oxide is formed.
Okay.
And the man that got the Nobel Prize talked about humming and also cells in the nose. I'm not sure how humming helps increase nitric oxide as well, but the anaerobes in the crypts of the tongue, but I'm not sure what anaerobes they are.
Well, to add to that, also they're actually discouraging. The biological dentists are discouraging very vigorous scraping of the tongue. You know those tongue cleaners. I mean, if you're gonna do it, sure, make it light, because you're gonna actually destroy these oral microbiomes that are responsible for that. So yes, so that is definitely true.
All right. One last question. You probably, Dr. Bieley, don't know that, but Dr. Nario. So, is the nitric oxide available in the Philippines?
Through a lot of spinach and a lot of arugula, because it's a country of farmers. There's a lot of farming there, but we'll find out. Maybe we can pull some strings to.
Yeah. Here we go. Yeah. Here we go. We're done. So, frozen.
In time, we have a research thing going on, and that just means we're sharing ideas.
Okay, well, I'm looking to commercialize the product and be appreciative of any assistance. I'm happy to pay a royalty if I can get this out in the world.
Sounds good.
Okay. Oh, okay. Thank you so much,
Are you
everyone.
a manufacturer or are you branding from the manufacturer?
I have the US patent and I have different formulas for secondhand smoke, smokers, pregnant smokers, and people that smoke less than a pack or more than a pack a day. And then also for people making a just quit attempt. I have a formulation that'll help them stay stopped longer.
That's cool.
So I just
Yeah.
ask people to sign a non-disclosure agreement if we're going to manufacture it, or you know someone that can help me get it out in the world. A third of the world still smokes.
Right, right. Especially in Germany, in Europe, they smoke a lot more than the United States, by the way.
Yeah.
And even Middle Eastern, we have a lot of smokers there too. Still in the Eastern country, they don't have that enforcing non-smoking in public area and all that stuff. It's not that. So the things that we did here in the United States did work, you know, forcing no smoking in public area did help to cut a lot of people from smoking. Sometimes regulations do help, you know.
Especially, it's been shown in Dubai. They have regulations, and that has decreased the number of cigarettes smoked.
Right.
On that.
Did you share the link for the CME? Because I did send it to you yesterday or before yesterday, Dr. William.
It's there, Dr. Halassa. We posted it on the chat, so
Okay.
everybody can just click on it.
So I think we will continue doing CME every week here.
Yes.
I just got the company getting the technical part starts rectified. Dr. William is not here.
I think his internet is a little funny, but he's gonna jump back in, I'm sure.
Yeah, no, my system crashed.
Oh, there.
It does at the end of every show anymore. So sorry about that. So somebody asked about Dr. Bieley's email address. There it is. Yeah, the CME credits are here for this week. I'll put it in the email for next week from last week, and I'm going to probably get it up on our website also for all of them. So you can go back and watch the ones that we did get credits for. Okay, so
Dr. Bill, I think Dr. Zarin also maybe wants to chime in for her event.
Yeah,
27.
Yeah, so the 27th is Dr. Zarin, are you there?
That's it.
Go ahead. You tell it better than me.
Hello, everyone, again.
Hello.
Hello. Thank you so much, Dr. Bieley, for your excellent presentation. So I found somebody opposite of me, so I always go overtime. Somebody has to stop me. And this one was very, very great presentation and right timing. So
thank you so much. You're very kind.
Thank you. No, that was excellent. So thank you, whoever signed up for our webinar on Friday, September 27. Some of you already signed up. We truly appreciate it and we love to see you. Still 2 days left, and we have some spots left available. And this webinar is a certification webinar. It's like a full, complete course. And the topic is on core principles of homeopathy. So myself, Dr. Clearfield, and another educator, we are going to cover several aspects of homeopathy, such as the laws of homeopathy, philosophy, principles, science, art, preparation, prescription, case-taking, and so many aspects in the domain of classical homeopathy. So it's as I said, is a complete course, and it's great for some of you who wants to advance in homeopathy, or even the beginner. You want to know what homeopathy is in case in the future you want to come into the domain of homeopathy, such as getting diploma in classical homeopathy or medical homeopathy. It's the best kind of preparation. It's making a foundation for you, makes it so easy to understand, because there are many schools, and one of the schools that I was I went there, so they did not teach us the way that we came up to make it more understandable. and for people. So it's for everybody, whoever is, interested to know about homeopathy, whoever is using homeopathy, wants to know the function of homeopathy, or whoever wants to add it to their practice or even convert to homeopathy. I think it's a great start, and it's making a great foundation for you. I hope to see you all there. Thank you.
Okay.
Dr. Clearfield,
Yeah,
can I make an announcement? Can I say anything?
of course.
Yes. Yeah, this is Dr. Tano. As Dr. Clearfield said in the beginning, my team and I, we have a software to write books for healthcare practitioners. So if any of you do have ideas and you want to bring it to life, please don't wait until you're not here anymore. I think it's probably time to bring your ideas to life, and we can help you do that. That's all that I want to say. So anybody has questions, you can always ask us, and we can answer those questions for you.
Yeah. Just as a side, so for Dr. You helped Dr. Halasa with his textbook, correct?
Correct. Yes. So
Yeah.
we did help Dr. Halasa with a textbook, and those of you who are in the attendance here, you could, when the book comes out, you could look at it. We also have a website. It's called Taya Pro Mediverse, and I can make it available for people to go there and see the books that we have in many, many categories. And you could appreciate how they look and how they feel in the content.
Dr. Tano,
Yes.
can you publish these things like in China and Japan? Like if I write a book on smoking and
Right.
put my formulas in it, is that something that can be done?
Yeah, it's possible to do that, but we have to figure out how to do it. I know how to do it on Amazon and other platforms, but I'm not sure about China or Japan, but we could figure it out.
Okay, because China has 300 million smokers and 700 million secondhand smokers.
Right.
From this,
India has about 120 million smokers, mostly poor, but 10% are affluent, and half the doctors in India still smoke. So there's
it could have a good reach actually if such a book were to come out. Yes.
Thank you.
and it's no lightweight. Dr. Halasa's book, I think, is 659 pages long.
Right. Yes.
Like that. Yeah, I have an advanced look. They asked me to write a foreword. Did you get the foreword, by the way? Did you get that?
Yeah, I got it. Thank you so much. Yes. Yes.
Yeah. So 659 pages, should take years to put together, the old fashioned way. So
right.
Okay. Dr. Tano, chime in anytime. You should show yourself, though. We don't see you.
Okay, sorry about that.
So, okay.
You can see me now, right?
There you go.
Yes.
That's better. He's got that Minnesota accent, he's
Yes, exactly.
Right. So
yeah, it's a hybrid the whole United States, French, Minnesota, New York, and everything else.
Okay. So don't forget Friday morning, Dr. Zarin's homeopathy webinar, Introduction to Homeopathy. I'm going to be at AMMG, Age Med Management Group in Salt Lake City, October 30th to November 3rd. I'm actually speaking on longevity, sort of stealing some of Ross Pelton's thunder on that. I think this week was OMED, wasn't it, John?
Yes.
So remember that was the one where they told me not to come because I don't know how to behave. That's the AOA's scientific convention where they the ones we were canceled from. So and we're proud of it. So so anybody else have any comments or questions? If you have any presentations any conferences you're presenting at or you're attending, please let us know. We like to hear what's going on, or all around the globe. We heard from Dr. Nario was in the Philippines, so just one comment. So my son, those of you know, lived in China for almost 20 years, and he married a Chinese woman. And at the wedding, the wedding reception, which was rather unusual. Every table had 2 packs of cigarettes on it when we got there, and when they got depleted, the wait staff put more out, so they kept the cigarettes coming. Apparently that's a tradition there. So
Wow.
apparently Beijing has the highest rate of COPD and lung cancer in the world. And the air pollution was pretty bad back then. I heard they cleaned it up a little bit, but yeah, that was kind of a revelation. You don't see that here. So but and not only was there cigarette packs out on the table when we got there, but if there were 2 packs on every table, as soon as they got depleted, they were replaced. So you have a lot of business to attend to, Dr. Bieley there.
Yes, sir.
Okay. All right, everybody, we'll go break up a little bit early tonight. Like I said, next week we have Dr. Gersh. Friday morning, make sure Dr. Zarin has a good attendance, or you're all in trouble. Okay, and
Dr. Bill,
yeah.
For A4M, October 7 to 20, women's hormones online. That's for A4M. If you want to sign up.
Okay, is it CME credit?
I think so.
Okay. All right. We'll check on that before that happens too. We'll be on before that. Okay.
Okay.
So everybody, thank you. So remember, last week's video on cannabis is not going to be on YouTube. It's on our website, and there's a link. It's on a Vimeo account we have also, but we're not going to put that one on YouTube because then we get the our hands slapped because of that. But if you want to see that one, just go to our website, aosrd.org, and go /webinars. And we got Dr. Block's talk on cannabis from last week there. Okay, and that one did have CME credits. So we'll take it from there. And Dr. Bieley, if you want the video of this talk, we'll send it to you when it's ready.
Okay.
And
Thank you.
we can also send you a participant list if you have anything if you want to get in contact with our members. Okay.
Wonderful.
Okay.
Thank you so much.
Thank you, everybody. One last word, John.
All's good.
Okay. All right. Great. All right.
Good night.
All right. Thank you all, and good night.
See you all.
Yep. See you all.